I'm Barbara Harris, co-chair with Carol Wolfsey of the Racial Justice Committee of Women's Voices Raised for Social Justice. One of our task forces that works within the committee is focused on criminal justice reform. And today's Lunch and Learn promises to be a very enlightening look at an innovative service in the city of St. Louis that's dedicated to helping people who are experiencing a mental health crisis. Mary Shuman and Ann Litwing are co-chairs of this task force, and they will tell us a little bit more about the program and introduce the speakers. So Mary and Ann, thanks for putting this together, and it's all yours.
Oh, thank you, Barbara. And good afternoon, everybody, and thank you for joining us for this important program. As Barbara said, I'm Mary Shuman. I'm a member of the Racial Justice Committee and also co-chair of the Criminal Justice Task Force. I will be brief in order to leave as much time as possible for our speakers and for questions after their presentations. Like many of you, I had heard of diversion programs operating out of prosecuting attorneys' offices and of the program Cops and Clinicians, but I had never, it wasn't until I heard a presentation on this partnership at a meeting of the St. Louis Area Violence Prevention Commission last fall that I began to understand the impact of this approach. The program we're going to hear about today takes place at the front end of the justice system. It keeps people out of the system, and most importantly, it provides help to the people who need it. The partnership between behavioral health resources and the St. Louis Metropolitan Police Department was activated in February 2021. It's 1 year old, and I think it's a good time to be looking back on how is it now? What impact has it had thus far? We have a large audience today that consists of people consists of mental health advocates, criminal justice reform advocates, civil rights advocates, law enforcement, policymakers, curious citizens, and probably a few skeptics. So this is clearly an area that has wide interest and people really care. Ann Litwin, co-chair of the task force, will introduce our speakers, and she will also facilitate questions from the chat box after the presentation. Ann?
Well, welcome everyone. We're very excited today to have our 4 presenters. I'll introduce them briefly, and then they will get themselves tell you more if there's more that they need you to know. Tiffany Lacey Clark is a Chief Operating Officer of Behavioral Health Response, Inc., and she has 17 years of experience in public-private partnerships and leadership development. She oversees BHR's clinical services, as well as many other parts of the organization, and she has a PhD in organizational leadership from the Chicago School of Professional Psychology. Bart Andrews, maybe raise your hand, maybe, yes, is a Chief Clinical Officer at BHR with more than 22 years of experience in leading training and evaluation of clinical care services. And his goal is to prevent suicide and improve care for those with depression, anxiety, schizophrenia, bipolar disorder, and or substance abuse. He emphasizes evidence-based practice, intervention and supervision. And Felicia Spratt, your hand, please. Yeah. Felicia is the clinical director at BHR. She's the clinical director at BHR's 911 Diversion and Crisis Response Unit, manages a 20-member team, works with community partners, and coordinates the care between St. Louis City and county police departments and the prosecutor's offices. More than 11 years of experiences, and she's enrolled and almost finished with her doctorate at Liberty University. And Lieutenant Day, yes, he is the commander of the Crisis Response Unit at St. Louis Metropolitan Police Department and has been with the police department for 10 years, oversees the Crisis Response Unit, which consists of teams of police officers paired with certified clinicians that respond to calls that involve any type of mental health crisis. So this is quite a team we have here today to tell us about the 911 diversion program. I'll turn it over to you.
Thank you. Good afternoon, everyone. I'm Tiffany Lacey Clark, Chief Operating Officer of Behavioral Health Response. Not yet a doctor, almost finishing that part up. But I wanted to take the opportunity today to really set the tone for what this process and this partnership means. We will talk about the data, we will talk about the fiscal impact and the time-saving impact, but I want to start with the people impact. So Felicia, you can forward to the next slide, please. We'll watch a brief video so you can get an understanding of the background. You'll have to do the advanced share so you can share the audio, Felicia.
I'm sorry, I didn't hear you, Tiffany.
You'll have to stop sharing and then reshare and click on the advanced button so you can share the audio as well.
Okay, sorry.
Thank you. It's okay.
And go from where? I'm sorry about that.
So stop your screen share
Okay,
and then press screen share again. And then it should give you the option to share audio at the bottom. It's like a, yep, there you go.
thanks.
The St. Louis Police Department is investigating the death of a
I'm sorry, you all.
man taken into police custody. 43-year-old Julius Graves died this morning after family removed him from life support. Officers tased Graves at a bus stop at Clayton and Hampton near Dogtown. Police tell us they took that action after he began acting irrationally and making threats. Police say the shocks did not work, so paramedics then sedated Graves. Graves' family attorney says they have documents from St. Louis Fire which raise questions.
Particular document has not been released to the police department yet. We were the first ones to get it, and we got it a week after the incident almost, which suggests to me they're not investigating this. And a man died as a result of the use of police force. There should be a homicide investigation to tell us what happened.
The documents obtained by the family's attorney say paramedics saw 4 police officers holding Graves down when they arrived. They go on to say Graves, who is diagnosed with paranoid schizophrenia and was suffering from hallucinations, was already handcuffed and restrained by his legs. Right now, the city is not commenting any further on the death or the investigation. The St. Louis.
Thank you. You can stop the screen share for now. Julius Graves was a very, very ill man when he was sick and he was not taking his medications properly. He was large, African-American male who could be very scary, looked very scary, very symptomatic when he was not doing well. I know that because Julius was my client. Julius was a person who walked me from my car to my office every day. He stopped me, he talked to me, he told me jokes every day. It did not matter what time I came in. He had a radar on him that alerted him to my presence in the St. Louis area. And he was going to make sure he came in and told some kind of a joke, talked about his family, talked about his educational background. He talked about his nieces and nephews. He was absolutely a delightful person. He was just sick. And when he was sick, his symptoms they could be scary. This program allows us an opportunity for when people are sick, they get help that creates an opportunity for them to be medicated correctly, an opportunity for them to be diverted to hospital systems and to treatment systems instead of the outcome that Julius unfortunately had. So the program has allowed us to interact with many, many more people just like Julius that did not have that same outcome. And we've been able to divert those folks, and the rest of the team will talk to you about how wonderful this partnership with the St. Louis Police Department has been for us and how wonderful it has been for the community, so that Julius's won't have to happen, and we'll have an opportunity to let his life mean something, his legacy mean something for all of us that are a part of this program. So we thank you for your opportunity to sit here today, to be able to share his story and to be able to share the impact that this program has had on the city of St. Louis and its residents.
Thank you, Tiffany. So I'm going to actually share my screen again. Good afternoon, everyone. So the Crisis Response Unit is comprised of police officers and the professional mental health individuals that BHR has employed from anywhere from the the criminal justice to mental health, social workers. A crew is consisted of one officer that is CIT, trained preferred mental health professionals in the department vehicle utilizing specific radio call numbers, which Lieutenant Day will speak on shortly. So when we're looking at the structure of crew, we're looking at where we have 12 clinicians that are riding along with the officers on a day-to-day basis, 7 days a week. We currently have 2 tours, and that is from 7 a.m. to 7 a.m. to 3 p.m. and then again from 3 p.m. to 11 p.m. Currently, we're working on the 3rd tour where it would be actually 11 p.m. to 7 a.m. as we see that the need has definitely arisen in the city. Then we also have 2 certified peer specialists, and those individuals are individuals who actually connect with individuals who need that additional support, who might not have a natural support system, mainly individuals who are unhoused, who does not have any family or any friends. And what they do is that they walk side by side with them and actually get them connected to services that they need. Then we also have a follow-up team, which we call like clinical care coordinating team. And that team actually connect individuals to care, call them within 24 to 48 hours to make sure that they are receiving everything that they need, and also identifying any additional resources that they may need for the future. Within our team, we also have 8 police officers that are primary officers. So these are the officers that actually work with our clinicians day in and day out. However, we do understand that they do need some time off. And so we do have additional officers that we utilize to fill in from all 6 districts. Currently, we are in the city of St. Louis only, and we have 3 patrols where we actually tour and respond to crises and any other traumatic experiences that individuals might be having. And that is South Patrol, Central Patrol, as well as North Patrol. And I will allow Lieutenant Day to speak on that additionally later into the presentation as well. So why do we need the crisis response unit? As Tiffany has already stated, Julius Graves is one individual that was experiencing a behavioral crisis, and we could have and should have done something differently.